Hi, good morning. My name is Callie Rolfe-Swong. I'm from Usaid, Washington. We have we almost have 300 participants in the room. So we are going to go ahead and get started. We're trying to keep close to time for our second annual local partner meeting. Let me just see if I can pull up our slides and then we'll get started. We have a great session for you.
Cargar nuestros diapositivos y vamos a comenzar. Tenemos una gran sesión para ustedes.
Give me just a moment. Okay, I hope people can see my screen.
J'espère que mon écran est visible.
Good morning. Again, I'm Callie Rolfe-Swong from the Office of HIV/AIDS in Usaid, Washington. Welcome to our Usaid second annual local partner meeting. I'm sorry we could not be with you in person, but we are very pleased to be able to be with you virtually this week. So in this session this morning, we really have quite a lot. So first we have our welcome, then we will do a little bit of virtual housekeeping from Foundation for Professional Development. They will let you know about the interpreter services, networking, posters, how the Zoom calls work, and we'll do a fun Menti poll. I'll go through the agenda and meeting objectives, and then we have the great pleasure of having Anjali Akbar from OGAC joining us for some opening remarks. And of course, Clint Kavanaugh, our OHA Office Director, will also be giving the opening plenary. Debbie Khalil from our group in OHA will provide some updates on the local partner transition. And then, save the best for last, we will have a fabulous co-creation, co-ownership panel with some Tanzania local partners. Before I turn it over to Suzanne to talk us through the virtual housekeeping, let me just give a huge thanks to our partner ASAP, especially IntraHealth and FPD, who have just done a tremendous job putting this conference together, working through the holidays, late at night, early in the morning, and then also training so many people on the platform, in addition to building it. So we are just so grateful for your help and support, and so excited to have this conference. So Suzanne, oh, wait a second, there's one more. This is very important. If you're having, or your colleagues are having problems connecting to this meeting, please email USAID LP meeting at foundation.co.za. So we can put you in touch with, these folks can help you get on the platform and make sure you're able to view the sessions. Let me turn it over to Suzanne, who's going to walk us through the virtual housekeeping. And Suzanne, I'll stop sharing my slides and you can share yours.
Okay, thank you very much, Callie. Good afternoon, good morning, everybody. Please, may you confirm that you can see my slides?
I can see them.
Okay, thank you so much. Okay, good afternoon, good morning. Thank you, everyone. And those of you who joined us at 7 or 1 on the dot, we appreciate it and hope you enjoyed the music. It is my pleasure to welcome you on behalf of the FPD Conference Secretariat. As we are meeting online and each platform is different, I have been tasked to present the virtual housekeeping for this meeting. Immediately after my presentation, we will ask you to take part in a short online poll. The purpose of this poll is to familiarize yourself with the polling software that we will be using throughout the conference, and also in order for us to learn a little bit more about each other. So I will be covering the following topics in our presentation today. We will do a little bit of Zoom troubleshooting because this seems to be the biggest challenge that delegates experience. I'll provide an overview of how to access the interpreter services and reminders in terms of how to update your profile and review the rules for the plenary sessions and the interactive concurrent sessions and breakaways. We will also look at some of the functionality that is available on this platform. And then at the end, we will review the polls we will be using, and we will ask you to take part in a 4-question poll. So the first item is troubleshooting Zoom. We've noticed that sometimes when delegates log in, they get a very small picture of the Zoom on their window. So it's difficult to see the presentations. If you are looking at a very small Zoom window, we are asking you to look for the link beneath your Zoom window. It says technical issues, launch Zoom app, and it will allow you to launch the full Zoom application in your on-air platform. And this will make the screen bigger for you to watch, and it will also give you more functionality around the chats, the mute, and the unmute. So when you log into the sessions over the next 4 days, if you see a very small Zoom window, please click on this link, technical issues, launch Zoom app, and that will relaunch the Zoom application and improve your viewing experience. We are also happy to announce that we have interpreter services available for the duration of the conference. We will be offering interpreter services in French, Portuguese, and Spanish. Each of these languages will have a channel that is available where delegates can log in and listen to the interpreter translate simultaneously. So to access the interpreter services, at the bottom of your Zoom screen, you will see a button that says interpretation. If you click that button, you should be able to see the options of these languages available: French, Portuguese, and Spanish. And there is an interpreter team on the other end of that channel. So choose the language you would like to listen to, and you have the option to mute the original audio. So you can have the English playing in the background, or you can mute it and only listen to the interpreted channel. So we will offer interpreter services for all plenary sessions and most concurrent or breakaway sessions. If you would like to make a specific request or query about the interpreter services, please send us an email at the Usaid LP meeting at foundation.co.za. This application allows the interpreters to listen on the main English channel and to translate into their own languages channel, and delegates would listen on the French, Portuguese, or Spanish channel. We encourage non-English speaking delegates. You are welcome to write your questions in these languages in the chat box, and we will translate the questions in the chat box, respond in English, and the interpreter will translate into their channel. This is just an overview of what it should look like. You should see the icon at the bottom of your screen. And if you click on it, you will see the list of languages. We've got English, French, and Portuguese available. If you are watching on a smaller screen like a phone, you may not see the application right away. So you must click on the 3 dots to see more applications to open the interpreter services. When we started our presentation this afternoon, we saw that there were over 300 delegates logged in. We have a total of 790 delegates registered for this conference. So please help other delegates find you. We're going to ask at some point today, when you have a chance, if you have not already done so, to go to the top right-hand corner of your on air, select Edit Profile, My Settings, and we are asking you to upload a profile picture of yourself and tell us some information about yourself, about me. The timeline should match the timeline of your computer. If you would like to change it, under the Edit Profile, you can select the time zone that you would like to use, and the timeline will update in line with your setting. And the third and equally important point, we are asking that you go under the privacy settings and select the virtual name badge with the full name and title so that other delegates can find you more easily. The software system defaults to first name and initial. As you see from this open plenary session, this is a Zoom application that we are listening on. And there are two different settings that we have for these large sessions with all delegates. Please note that all participants are on mute and you cannot unmute yourself, but hosts and panelists can mute and unmute themselves. Only presenters can turn on their cameras. I've spoken about the available interpreter services. We encourage delegates to type comments in the chat box throughout. It is being monitored by the team. And when it comes time for questions and answers, you may type a question or comment in the text box or raise your hand and the host can unmute you to ask your question. So these are the settings for the full plenary sessions. For the smaller interactive concurrent sessions or breakaway groups, we have similar settings, but a bit more functionality. So the default setting is mute. When everyone logs in, they are on mute. And when a speaker is presenting, the other participants are on mute. But in the interactive sessions, everyone can mute and unmute themselves, but due to the number of delegates, we ask you to please raise your hand, wait to be acknowledged by the host, and then either they will unmute you or ask you to unmute to talk. We are also asking that delegates keep their cameras off to limit the bandwidth for the other viewers. The interpreter services are available for most of the sessions, and the similar protocol, we encourage delegates to participate via the chat box and also to raise hand to be called on to unmute to ask a question. The on-air conference platform also has other functionality to assist you to learn and engage with the other delegates. There is a networking function on the main page where you can connect with delegates and you can see who is logged in, who is registered for the conference. You can ask to make a connection and then set up a live chat, a call, a meeting, or send a message through the platform. We also encourage delegates to explore our poster and program gallery and the exhibition hall. The poster and program gallery has posters submitted by delegates, but we've also put up a PDF copy of the agenda, user guide, the Zoom troubleshooting, the interpreter services, and this presentation for future reference. The exhibition hall will be available from the 8th to the 9th of October for delegates to explore the booths of organizations and missions, to view their material and download. For those organizations who expressed interest in hosting an exhibition booth, please note the final deadline for submission is tomorrow, 12 p.m. Central African Time, 6 a.m. Eastern Standard Time, to submit any outstanding material in order to give the conference team time to upload the exhibition booth. Lastly, all presentations and recordings of the sessions will be available the following day. They are available to download from the ASAP website. It is up here, but if you Google IntraHealth and ASAP, it comes right up and you'll be able to access recordings of the sessions and presentations. We will also be uploading recordings of the sessions on the timeline on the following day. So by tomorrow, when you log in, you should be able to see today's recording sessions on the timeline. And last but not least, if you are on the session and you need help, please look for the red links of Ask for Help or Live Support. And there is a team from the conference department who are ready to assist in any way that they can. If you have colleagues who are struggling to access the platform or have lost their password, please encourage them to send an email to us at usaidlpmeeting@foundation.coza in order for us to provide the support for them. And the last item on our housekeeping is an overview of the polling applications that we will use. So even though we are online, we would like to get as much participation and input and feedback from our delegates as possible. At the end of most concurrent sessions, we will launch a 3-question Zoom poll in the Zoom application and ask for feedback on your experience of the session. We will also be using a software program that is called Menti, and it allows us to do interactive polls to ask questions and get real-time feedback from the delegates. So when we launch a Menti poll, you will see the name of the poll on the screen and the website and the password at the top. To participate in the poll, you must open an internet browser window, type www.menti.com, and enter the 7-digit code that you will see on the poll. So once you enter the code, you click submit, and you will see the name of the poll you are participating in. Click next, and to take the poll. So with that, we would like to do our first icebreaker with the Menti poll. If you will bear with me for one moment, I will stop sharing this screen and open the Menti poll. Sorry. Present. Okay, now I would like to, oops, sorry, I think I just put on my other screen. Apologies, one moment, please. My apologies. Please bear with me for 1 second. Oh, there it is. Can you see my Menti poll? Can someone confirm if you can see a screen that says Icebreaker Day 1?
We can, yes, we can see it, Suzanne.
Okay, so now in the last 3 minutes available, I would like to ask you to, those of you who would like to participate, to log into the website www.menti.com and to use this code 1205541. So you may log on with your smartphone, you may open a new window on your browser, and this is for delegates if you would like to participate in the icebreaker poll. So I will repeat again. Log into www.menti.com. It will ask for a unique code, and I'm asking you to enter 1205541. Okay. For those of you who are on another session, on another platform. I'll repeat the code. It's 12-05-541. And if you would like to participate in the survey, you should see the phrase Icebreaker Day 1, and you click on Next, and you can start the 4-question survey. I see that we have 5 delegates who have already registered and accessed. So let's start to see the responses. Ooh. So 68 delegates, look at this. Tanzania, South Africa, USA, Malawi. We've got a global team. We are covering the world. I see South America. I see Africa. I see North America. Excellent. Okay, give delegates another 30 seconds to complete your poll, and we will go to the next question and show the responses. Okay, Swaziland, Guatemala, Uganda. Okay, so 105 of you, thank you for your input. Question number 2, how are you feeling today? Excellent, most of you are excited, most of you are hopeful. There's a couple anxious and some tired people. I imagine the tired people are calling in from South America, North America. Okay. In 1 or 2 words, reflecting on COP19, what are you most proud of? So, local partners, teamwork, achieving targets, resilience, a lot of excellent progress. So we will download this icebreaker poll and also share it with the delegates on the website for people who would like to hear what other people have responded. The last question before I hand back to Callie. Final question. In 1 or 2 words, what is on your mind for COP20 implementation? Targets, hopeful, funding, results, quality. Excellent. Okay. Well, thank you very much for your time and your attention. And thank you for your participation and contribution to our Menti poll. It will help us understand what you're thinking and help us structure our sessions more in line and to collect your voice. So thank you, everyone. I wish you all a productive and informative meeting. And I hand you back to Callie to start with the agenda. Thank you very much.
Thank you so much, Suzanne. That was so fun. Let me go back to my presentation. So give me just a second. Okay, I hope people can see, right? Can people see the slides again?
Yes, we can.
Okay. Okay, thank you. I'm going to just run through quickly the agenda. Again, I'm Callie Ross-Wong from Usaid Washington, Office of HIV/AIDS. I am leading the Capacity Building and Partnerships branch, and our team has been coordinating these local partner transition efforts. So who do we have here today? We have almost 400 local partner representatives from nearly 130 organizations. We have 158 field staff that have registered, 104 HQ staff, and 25 host country partner representatives. One of the features of our meeting this year is really a focus on local partner voices, experiences, and best practices. And we are also able to invite more partners than we did last year. So we invited all of our local partner primes for COP20. So it is really a pleasure to have you here. So why are we here? A few days ago, October 1st was the first day of COP20, as I'm sure you are all aware. And we really want to make sure our local partners are prepared to have the best COP20 performance possible. We want to make sure that you have technical and operational excellence in COP20 and give you this platform to share your practices and to hear guidance from Usaid. We also want to improve how we work with local partners. So we've structured a whole day, day 3, and Catherine Hoflich on our team will be talking to you about that. And we really want to hear your feedback on how we can improve our work with the local partners. And lastly, we heard last year that partners really wanted a more chance to learn from each other. So we've really created a platform this year to provide a chance to exchange and create communities of practice. So I wanted to share with you quickly some results from our survey that you answered when you registered for this. So you see here the top 10 goals that people said they wanted from the meeting. So they want to learn best practices, implementation strategies, opportunities to network, COP21 priorities, how we program during COVID, which is something we're definitely going to be talking about, opportunities for local capacity building, financial sustainability and self-reliance. We have a session on that. Usaid funding, how local partners are selected. We're going to be talking about that a little bit in our plenary today. The transition, Debbie is going to be talking about that today as well. Usaid policies and monitoring and evaluation. I think we have sessions here to cover all of these things. So I hope you will enjoy them. And then this one, really good. What does Usaid need to do to improve on its work with local partners? Capacity support, yes, we agree. Flexibility, facilitate collaboration, support financial sustainability of local partners, support during startup, more technical guidance to improve the quality of service delivery, more guidance on Usaid rules and regs, strengthen collaboration with local governments, operational support, and strengthen collaborations with the private sector. Great feedback. Again, we are going to have more opportunities to hear from you on day 3 and throughout the session. So this kind of feedback is really what we want to hear during our meeting this week. Okay, and then just a quick look at the sessions that our partners are really interested. So high demand for the OVC and prevention sessions, COVID, gender. I think there's a little bit of a demand for all of the sessions, so that's good. Lots of interest in the organizational sustainability session, monitoring, learning, evaluation, transitioning to a prime partner, fixed amount awards, community-led monitoring. So I just want to acknowledge that people are here on this Zoom call, on this platform from across the world. So just listing the different time zones here, we are trying to end around 11 a.m. Washington time every day with a start at 7 a.m. In Africa, that's sort of an afternoon event. In Asia, that's evening, and of course in the Western Hemisphere, it's also early morning. So our agenda today, we are going to be focusing on COP20 operational and technical excellence. Tomorrow we will also be focused on operational and technical excellence, and we have a number of excellent panels with local partners presenting both today and tomorrow. As I mentioned, on day 3, it will be the opportunity to provide feedback to Usaid, and we will have some rich small group discussions where we'll do that. And Friday is really, it's a Usaid free day. It's only for local partners, the opportunity for networking and creating communities of practice. So then quickly through the agenda today, and I've talked through this just a little bit. We have our welcome and orientation now. We'll have some opening plenaries from Clint Kavanaugh and Debbie Khalil. Our Tanzania panel focused on co-ownership and co-creation. And then at the same time as the Tanzania panel, there will be a leadership town hall. This is for local partner executives. It's an invite-only event. It is actually not on the on-air platform. It is a separate Zoom call. Every local partner should have received an invite to send one of their executives to that meeting. If you did not, please email the email address that I sent forward earlier. And then following the co-creation and leadership town hall session, we will have our first round of concurrent sessions, testing and reaching the first 95, operational and strategic information, and OVCs, and then we will come back for our day one wrap up. Tomorrow we have a number of concurrent panels. I think 10 different panels in all, so please join the ones that you are most interested in and have an opportunity to engage in those discussions. And then, as I mentioned, on Thursday we will be doing small discussion groups and feedback to Usaid. We will have some mission directors available to give some remarks, and then we will have a really exciting closing plenary with two of our oldest local partners, JCRC and Right to Care. And then closing remarks from our office director. And Friday, as I mentioned, is the networking community of practice day. And so here you can see some of the communities of practice that you will be able to join on Friday. And also, I just want to emphasize Friday morning through the early afternoon, the exhibit hall, the poster session, and the networking functions will all be available to you. Lastly, just a special plug for the infamous Doug Frankie. He has made himself available to all local partners every day after the meeting concludes. He will answer any question. No question is too small or too large for him to handle. So please take advantage of Doug while he is here. It is also a USAID free zone. You can ask anything you like, and Doug will never tell us what you asked. So please take advantage of this great opportunity. Doug is an expert on all things compliance, and really great opportunity to have those questions answered. And then I really want to emphasize today's wrap-up session is especially important. It will help us shape our day 3 feedback discussions. So please return to the wrap-up session today after your local partner panels, and we will do a group activity. Here are a few links for the SCAT COVID guidance and our ASAP webinar series. And lastly, just a few ground rules. Clear your time and pay attention to these sessions. I know sometimes it's a little bit hard in a virtual environment to do that. The Zoom calls actually start on time and they end on time. That will force us to all be on time. So turn your email off and use the chat function. Connect and network with USAID and the other local partner delegates. Hopefully you will learn something and you will have fun, and we will all get ready for COP20. And then very lastly, I would like to give a huge thanks to our OHA meeting organizers, Catherine Hoflich and Courtney Irwin, who have just worked tirelessly to put this together. I am going to turn it over to Clint now for our plenary presentation from our OHA office director. Hold on just a second.
Great. Thank you, Kelly. And thank you all. Good morning, good afternoon, good evening. I'm so excited for the next 3 days. This is going to be another exceptional meeting, just as we had last year. Under ideal circumstances, we would be in Johannesburg, seeing each other in person, But given our current circumstances, I really just want to thank FPD, ASAP for really putting together the next best option, which is the virtual platform we have in place today. It is so exciting to see so many of the familiar names on the attendee list. Suzanne, it was great to hear your voice this morning. I will be talking through really where we've made tremendous progress as an agency in the advancement of support to local partners, to highlight some of the successes we've had in advancing PEPFAR objectives, but also some of the innovations and adaptations that have come out of the COVID response that have been generated by our local partners. We'll be looking at ways in which we can continue to collaborate together over the next 3 days, ways in which we can support you. But before we do that, I want to stop and really, we've got Anjali Icebreaker here. Unfortunately, we had some connection issues, so Anjali will be providing, I have her here on speaker, but really just to say, Anjali has been incredibly supportive of Usaid in this transition. Much of the headquarters support that's been provided by PEPFAR has really been through the recognition of the investment we need to make in local partners for setting them up for success. Anjali has been really with us every step of the way to identify what are the assets that are needed to support local partners, how can we support them in around analytics, around project management, and then also to provide them the technical resources to really achieve success in the PEPFAR space. So I'm going to hand it over to Anjali for a greeting from her this morning. Anjali, over to you.
Thank you so much, Clint. Can you hear me okay?
Yes, we can hear you.
Fantastic. First, let me just thank you, Clint, and the entire team at Usaid for convening such an important meeting and really bringing the local partners together. This is really critical as we launch into COP20. Thank you for inviting me to participate in this meeting and joining you. I'm sorry I couldn't be there on web, but I'd really like to take a moment to thank all of you in the audience there. I know there are hundreds of you that have registered to join across the globe. There's so many CEOs and senior leaders in the audience and tuning into this important meeting that really represent our local community partners. We do recognize your busy schedules that you're maintaining, especially in the context of COVID-19 and everything that we're working on. So we really appreciate the time you're taking today to join in for this meeting. As many of you know, since PEPFAR launched in 2003 and over the past 17 years, together with countries, communities, and partners, we've really made incredible progress together controlling the HIV pandemic. And really, you all play a critical role in making that happen. Over the past few years in particular, as we've really been strengthening our sustainability approach by bringing in local partners in a very intentional manner to the PEPFAR programming, this has been a critical component of the sustainability approach. Many of you also know that Ambassador Burks, whom I bring her greetings, she sends her well wishes. She first announced the local partner transition goals at a principals meeting back in April of 2018. The goal that we have all sort of adhered to since that time was bringing in 25% of prime funding by the end of fiscal year 18, 40% of funding by the end of fiscal year 19, and 70% of funding by the end of fiscal year 20 by agency to really focus in specifically on prime funding to local partners. What COVID-19 has shown us is that local partners on the ground that know the communities, are of the communities, serving clients, it has been critical. You all, your teams are the ones on the ground continuing to provide and sustaining that those HIV prevention and treatment services over time in many times of crisis. You've been there through natural weather disasters, through civil unrest, and most recently through COVID-19. What's been extraordinary to see over time is that local partners, all of you who you represent, your teams on the ground, not only are you there sustaining the impact, sustaining the services, the life-saving services for the people that we're serving, but you're also exceeding targets and exceeding performance and bringing, as compared to international partners, and really bringing critical client-centered, community-focused, innovative solutions during a really challenging time. So again, you are essential. You're essential to where we are in this pandemic and helping us to ensure that countries are able to sustain epidemic control for the full range of HIV prevention and treatment partners as we move throughout time. Again, ensuring that these services are owned and operated and led by local institutions, governments, and communities on the ground. Again, I really want to thank Usaid and the leadership all up and down the agency for moving as swiftly as you have to really bring direct funding to local partners in an incredible, rapidly time frame as you've done. You've done really a tremendous job, and again, bringing partners together in fora like this are really critical to make sure we're all on the same page as we move forward. I really hope that this meeting provides you with the platform to share those best practices, those lessons, those innovations that you're bringing, your teams are bringing on the ground. Again, I really want to thank Usaid for your leadership in the local partner transition and also supporting the local partners as we move forward. So again, just thank you for the opportunity for speaking and being here with you today. Back over to you, Clint. Thanks very much.
And thanks, Anjali, and really appreciate the partnership. It really has been critical to have your support as we move so ambitiously toward the 70%. So very much appreciated.
Absolutely.
Okay, great. So I'm going to launch right in. We have a lot to cover. And so why don't we jump into the deck? So just as Anjali said, next slide. We launched this effort in FY18 with the plan to have 25% of local funding the first year, as Anjali said, 40% at the second year, and by the end of FY20 being at 70%. This was a huge lift. Many of you have worked with Usaid previously. There have been focused efforts to really develop and engage local partners, but the lift over this time period was more ambitious than we'd previously taken on. Just as Anjali said, to do that, we really worked to ensure that we had the systems in place throughout the agency. We set up something called the PEPFAR Oversight Board, chaired by our Chief of Staff, Bill Steiger, represented by agency leadership across bureaus, to again identify how can we move systematically, almost as a corporate entity, given that we're primarily a decentralized organization, to get to this target. We work to amend agency policies to support transition award to local partners, to really come up with innovations around contracting, to really ensure that we are moving at a good clip. Next slide. It also dovetailed with the agency's effort around the new partnership initiative under the Journey to Self-Reliance. So really looking at ways in which we can elevate local leadership, foster creativity and innovation, and mobilize resources across the agency to support local efforts. Next slide. So many of you have seen this slide. When we started this effort, we were at 33% of funding in PEPFAR to local institutions in COP18. By the end of COP19, we had already advanced to 44% of funding. For COP20, the COP that began this week, we're at 53%. So not at the level we had hoped, but based on our procurement portfolios in place, we project by the end of COP21, we'll be at 64%. We're also looking at ways in which we can continue to accelerate in getting to those projections, but also to the 70%. So looking at ways in which we can capitalize on our G2G relationships, particularly at the subnational level, enhancing the work of regional partnerships that are accounted for in the local partner transition. But really, again, exciting to see the accelerated work that has happened in such a short period of time. Next slide. Ambassador Birx at IAS this year highlighted the success of USAID in this regard. She said, "I'm so proud of the work of USAID, who's now achieved 53% from a low of 35% just 2 years ago. They'll be close to the 70% within the next 12 to 18 months. And it's clear that work we did together is allowing us to sustain the gains in this very difficult time, because it's our local partners who remain on the ground along with our embassy personnel." So really a call out to not just the work of the agency, but to get to the 70%, but really, and as you well know, it's been our local partners who have helped to protect the investment of PEPFAR, to ensure that our clients remain on treatment in under COVID-19, and have really been critical to protecting our program over the last 8 months. Next slide. So you can see, again, the number of local awards that have also been achieved. So in COP18, we were at 107 local awards, and in COP20, we're at 181, which is huge. And again, given COVID-19, that there is huge potential to capitalize on this investment of by PEPFAR to really enhance the roles that our local partners play well beyond the HIV response. Next slide. So you have seen we've added 76 new partners, and you'll see in the data in the shifting in targets to local partners that our local partners are implementing across the care and treatment cascade in prevention, key populations, OBC services, and again, have shown in the COVID response the ability to work well beyond HIV. We've seen our local partners play a critical role in the COVID response around risk mitigation, communications, and decentralized delivery of services that have supported family planning, malaria, and other critical services in light of COVID. Next slide. So this just gives you a sense of how targets have shifted over time to local partners. You can see with local partners being in red, international partners in blue, how over the COP18, 19, and 20, our local partners have taken on a greater proportion of the clinical cascade across testing, treatment, and prevention services. Next slide. So we're also looking at how our partners are performing. We just recently wrapped up our Q3 reviews. Our team has been working to distill and compare local performance versus internationals, and present some of that here. Next slide. So again, as a global scorecard that we as an agency routinely update, just for your awareness, for the 16 million clients that PEPFAR supports on treatment, USAID supports roughly 6.1 million. I will highlight there's some nuances here. We've had some challenges with South Africa reporting over the last quarter, so some of these indicators do not account for South Africa, so you will see some skewing of the data. For multi-month dispensing, of our eligible cohort, and again, this doesn't count South Africa, so that you'll see that the number is slightly less than the first indicator, but 73% of our USAID cohort is receiving multi-month dispensing. That is huge and has been, again, critical under COVID to ensure that our clients do not have treatment interruptions. As an agency, we contribute around 38% of treatment news. We have been supporting, as of Q3, 41% of positives identified through testing, and we support nearly 38% of TB services. prevention services. Next slide. This just gives you a sense of how across agencies, Q3 was really, as you will know, our first real indicator of how of the impact of COVID-19 on our PEPFAR programs. So this shows the last column shows our FY20 performance to date. Note that it doesn't include Q4 yet, but just gives you a sense of the impact of COVID on services. You can see that, again, we've had challenges in absolute numbers of individuals tested positive, obviously, and we'll see challenges around retention and treatment curve, but we are seeing positive data points around linkage to treatment, which has been critical. We've seen some solid data points, not across the board, but related to retention through multi-month dispensing. But again, seeing some challenges based on Q3, but frankly, not as severe as we anticipated. Next slide. So again, it's been critical to really ensure, and we've talked about this before, but really the ability to track viral suppression for the clients that we support. As an agency, through Q3, we were achieving 74% achievement around viral coverage, but 92% achievement of suppression. And really, as we know, what's been critical to suppression is to ensure uninterrupted supply of drugs. So I'm incredibly proud of the fact that as an agency, 73% of our cohort is receiving 3-month. We're also at 18% of the cohort receiving 6-month, and you'll see in examples of where we're far exceeding that in 6-month in a number of countries. This is going to be the critical work over the next few months, is to really facilitate that hydraulic shift between 3 and 6 months where policy allows, so that we can continue to ease and address barriers to services. And we know that access to drugs is one of the greatest barriers. So the extent we can facilitate 6-month and even decentralized solutions, that will be critical to addressing challenges to retention. Next slide. So again, this gives you a sense of where COVID really hit us around net new. And you can see, based on Q3, the loss of nearly 100,000 clients from Q2 to Q3, with 81,000 of those happening in South Africa. We obviously also saw impact in voluntary male circumcision, given the global pause. So while that decline was expected, that net new is something, and the circumcision work will start back up again as it is allowed to. But it's that net new where we really want to unpack where we're seeing the losses, and again, focus our efforts to return clients to services and really facilitate keeping them engaged into services. Next slide. But again, huge success in linkage. While our overall absolute numbers identified as new positives were reduced given COVID, those identified were successfully linked to services. 94% proxy quarterly retention for Q3, and our patient loss proxy was not, as I said, not as severe as we anticipated. This is something Anjali was quite taken aback with, and as well as in the interagency space, that given all of the challenges, the loss wasn't as significant as we anticipated. Next slide. This gives you a sense of the impact of COVID across countries, and you can see the gradation of lost and the challenges experienced was different across countries. You can see South Africa, Zimbabwe, Eswatini. I won't go through every country, but you can get a sense of where we saw both high and medium impact in services, and then some of the countries where we didn't see, based on the burden of COVID, as extreme an impact in programs. Next slide. As you well know, we're also trying to, not just with net new, but with our viral load data, begin to unpack that at the subnational level to better identify where we need to focus support, particularly in the sustained epidemic control era. Where do we need to get, where is that last mile? And then once we get there, how do we focus efforts to ensure that we protect the investment of PEPFAR to get us to sustained epidemic control? So moving forward, we will be triangulating a number of these data points and depicting it geographically. We do want to focus more on geodepiction of data, layering of where partner footprints are, but really beginning to triangulate key data points, multi-month dispensing, viral suppression, treatment curve, et cetera. Next slide. Speaking of viral load, this gives you a sense of, again, where we need to focus efforts around coverage. Coverage is critical. If we don't have the viral load coverage in place, we won't get to that understanding of achieving suppression, which again is the litmus of success ultimately for the clients we serve. So the countries where we're at less than 50% coverage, and even at the higher levels, less than 75% is where we need to work across the interagency space to ensure the lab capacity is there, specimen transport, results return, but that we're also acting on these results at the facility level. We want to also see that we're depicting this in our analytics and triangulating, again, these data points with our other PEPFAR data points to ensure that given the enhanced capacities we now have in place in the lab sector, that we are having that inform our response. Next slide. And again, depicting that geographically so we can identify where are we seeing hiccups in suppression and where do we need to align partner, government, and other resources to ensure that we are identifying solutions that are appropriate for the contextual nuances of the regions where we're not seeing as much success as in other regions. And this gives you a sense of that gradation in Mozambique and Zimbabwe. Next slide. So again, looking at partner performance by our local partners and international partners, we saw a good traction in performance, but when we get to Q3, you can see that as it relates to case finding in positivity, seeing a dip in performance by our local partners as compared to our international partners. Also seeing a dip in contribution to treatment net new, and again, some challenges around retention as reflected in treatment curve. Next slide. And again, seeing variability in partner performance in these indicators across countries with some of the greatest performance challenges in Namibia, South Africa, and Tanzania. Next slide. But again, we're also seeing areas of success, and you can see as it relates to linkage, our local partners are doing significantly better than our international partners. So linkage to treatment, a major success. And you can see that success across a number of countries in the chart on the right. Next slide. Around retention, again, seeing some challenges by our local partners as compared to international partners. And this is where it's going to be critical to ensure that we are translating some of those solutions that have been applied in other settings by other OUs to the SNUs where we are seeing retention challenges. And over the next 3 days, really sharing what are those successes so that we can address the retention issue. Next slide. So again, we've seen over the last 8 months or so, real innovations and acceleration of adaptation and adoption of these innovations across countries by partners. Next slide. This is from Zambia. You can see acceleration of multi-month dispensing, and here particularly 6-month dispensing. What is so exciting to see is, and it's somewhat blurry, but if you see on the bottom, between March and June of this year, the percentage of all clients on MMD more than doubled. The percent of eligible clients on 6-month MMD went from 42% to 81%. This is huge, and it's really been the cornerstone of our Zambia program, getting to near 100% proxy retention, and obviously facilitating great success in viral suppression. Next slide. Here's an example from Deloitte. They're the local partner in Tanzania. And you can see over the last 3 quarters, they've been able to protect, for the most part, their treatment cohort. You can see they've actually added clients to treatment curve, which again has been through the use of different approaches to multi-month dispensing, decentralized services, home-based counselors, to ensure that they didn't have loss. Next slide. Here's an example from our work in Nepal to really look at different approaches to virtual engagement of clients. We've seen incredible examples of telehealth and digital adherence solutions, even in low resource settings, to support clients in light of COVID. There's been virtual data collection, social media peer champions, phone support that has really helped, again, to support clients during this challenging time. And again, seeing innovative solutions around home-based delivery of drugs to support clients given challenges to access facilities. Next slide. Here's an example of Project Hope in Namibia, where using virtual assessments in their DREAMS program, they reached over 10,000 girls. They have identified 156 GBV cases in April, which was roughly 4 times more than the previous year's monthly average. Again, using virtual needs assessments, and different approaches to continue to engage women given challenges of engaging them in our previous models. Next slide. Here's an example from Vietnam related to use of campaigns to support self-testing. They've done a rapid pivot to support online ordering of self-tests, have seen that it meets the demands of clients. You can see 67% of self-testing clients preferred online ordering. And this has really been an example of where self-testing can help us address that case finding challenge, where we're not seeing the overall absolute numbers. We're seeing good linkage, but our overall case finding and absolute numbers of clients identified as positive has been a challenge. So not just in Vietnam, but across a number of OUs, our partners are looking at innovative solutions around scaling of self-testing. Next slide. So we're also looking at how, as we get to sustained epidemic control, we as an agency can leverage the entirety of our agency assets to support the HIV agenda. To date, we've worked, 17 years into PEPFAR, we've worked tremendously to get to epidemic control, but we know as the resources will be going down in the next phase of the response, we're going to have to be more efficient. We're going to have to be more strategic in the way that we target resources to ensure that, again, we protect the investment of PEPFAR to date. And in doing so, really need to leverage our assets well beyond the Office of HIV/AIDS, and not just within global health, but across bureaus within the agency. So we've been working over the last few months to develop an optimization plan that we can bring to the table so that we're all marching to the same sheet of music, that we are aligned in our understanding of those resources, and we can plan to implement them in a coordinated and strategic manner. Next slide. So we've done nearly 80 interviews, both internally and externally, including ambassadors, mission directors, agency leadership, global health leadership, key partners, to really identify ways in which we can better link with other health programs, to leverage our non-health programs, including democracy and governance, economic growth and education, to have a more purposeful private sector engagement strategy. And we see local partners as critical to that sustained response. To better depict the way that we see these resources playing out, we've identified 7 country deep dives, or developed 7 country deep dives that articulate how these different pieces can come together in portfolios and in contexts with different challenges, different models, and different approaches. So again, we can use those 7 deep dive examples to inform our response in other OUs as well. Next slide. So this gives you a sense as we're doing the work on the optimization plan, where we're at across the landscape as it relates to proximity to control. Also looking at country capacity and looking at, again, the nuances that would need to be put in place to support a sustained response given these disparate factors. Next slide. Also looking at and developing analytics of where we have broader health investments beyond HIV so that we can leverage those investments. And you can see here, particularly in Nigeria, Mozambique, Zambia, Kenya, Malawi, in Zimbabwe, where we do have significant resources beyond PEPFAR and HIV. And we know that it's critical that we begin to leverage those resources, again, as it relates to commodity distribution, decentralized service delivery, case finding, et cetera. And so we're working intentionally to really bring this all together over the next few months. Next slide. Zambia is an example of where we can, there are opportunities that we can harness now within the project supporting youth. We can harness the potential of young Zambian leaders in public management, civil leadership, business and entrepreneurship to make positive change in communities, in domestic resource mobilization, leveraging our resources beyond HIV to increase public investment in service delivery and poverty reduction, and also leverage our broader assets around community engagement. Again, we've seen that in the COVID response as it relates to delivery of commodities, but also as it relates to risk communication. Next slide. So next steps, we are working to develop milestones that help to guide the work within the optimization plan. We anticipate to have a written plan rolled out to our field colleagues in mid-November, as well as our implementing partners, and really looking at what are bold and innovative actions that we can all collectively mobilize around over the next 3 to 5 years. And again, seeing local partners as cornerstone to this work. Next slide. So just to quickly talk through what's anticipated for the next COP process. Next slide. This gives you a sense of the milestones over the next few months. As we know now, the COP development process will be virtual. It will be roughly the same timeline as we had for COP20. As of now, the COP21 guidance is being drafted. We expect that the draft will go up for public comment in November, with the final COP guidance being issued publicly in December. The planning level letters will go out in January. There will be virtual COP meetings, and then the intent is really to bring this to a close at roughly the same time period as this year so that we can advance funding as quickly as possible. Next slide. So we know for COP21, there will be 4 areas of focus as identified by SGAC, really focusing around client-centered services, particularly given COVID-19, community engagement, resilient and adaptive approaches, and support for sustainable capacity. And we'll be talking through these 4 buckets over the course of the 3 days. Next slide. Lastly, we want to do whatever we can to support our local partners and really tee you up for success. We're going to be continuing our monthly implementing partner calls, using those as a forum to ensure that our partners have information as we get it, continue to support local partner CEO meetings, so that we can again hear from our CEOs as it relates to the challenges, but also opportunities that are available to really tee our partners up for success. We'll be continuing our COVID implementing partner solution calls, bi-weekly newsletters to implementing partners. ASAP will be continuing to support webinar series for local organizations. And as we are today, supporting this annual local partner meeting. Next slide. We want to promote your success. I can tell you, just as we were presenting those programmatic adaptations, myself, our office, where we have these successes, we are channeling them within the agency, externally, within the interagency space. So I encourage you to continue to document, to replicate where you're seeing good depictions of success by other partners, by other programs. But really, we want to share your success, to highlight your work. We have a comms team in place in OHA that can support you, but really see this as a priority because, again, your success is our success, and we want to highlight your work. Next slide.
Clint, sorry, I'm having trouble with this, but I think that was our last slide.
Wonderful.
So go ahead.
Thank you all. We will have more time to discuss over the next 3 days. I'm excited for these 3 days. I really, though, want to end with a thanks for our capacity building and partnership branch team, particularly Callie, who you've been hearing from this morning, Deborah Khalil, Courtney Irwin, Lindsay Bonanno. This has been a phenomenal team. You've seen the work that they have supported in this meeting, in the meeting last year, but really the support that you're getting throughout the year. So just a thanks to them. And again, looking forward to the discussions over the next 3 days. Callie, over to you.
Thanks, Clint. And now we're going to go to Debbie Khalil from our Usaid OHA local partner team, who's going to be sharing some additional updates on our local partner transition work. Okay, so Debbie, I have your slides, and let me just go to presentation mode.
Great. Good morning, good afternoon, good evening. Thank you, Clint and Anjali and Callie, for that great introduction. I am Debbie Khalil from our Usaid Washington Office of HIV/AIDS and working with Callie and our team on the local partner transition. Following Clint's overview of our office approach and priorities, I'm going to go a little deeper in our focus on the local partner transition and how we're looking at data and supporting success for this fiscal year that just started October 1st. So next slide. Before we jump into the details though, I wanted to take a moment to pause and recognize the great work and successes of our local partners to date. If you go to the next slide. We have data through June of this last year. That's 3/4 of our data for this last year. And in terms of prevention, we're so excited to see that our local partners, USAID's local partners, have supported 1.7 million children in OVC programs. that USAID local partners have enrolled over 17,000 men in voluntary male medical circumcision programs, and that our local partners have served over 213,000 key populations with our prevention programs. On the next slide, we'll look at our testing and treatment portfolio. And again, with 3 quarters of data as of June of this 2020, we've seen that local partners have supported over 8.1 million patients who've learned their HIV status, that they have identified, and you all have identified, 357,000 new cases of HIV and linked 92% of those cases to treatment to get people enrolled on ART, and that our USAID local partners are currently supporting 3.4 million people on ART. So if we were in person and live right now, I would pause and have everyone clap. Unfortunately, we're virtual and you all are on mute, but I want to say, please, around the world, I want to hope everyone is clapping for that great success. Thank you for this work. It's incredibly impressive, and we're so amazed at all that our local partners have been able to accomplish. So next slide. Clint and Anjali already noted this, but I wanted to just emphasize why we are pushing this transition to local partners. The 70% goal is about sustaining our epidemic control and ensuring that all our HIV programs and services are owned and operated by local partners. That's institutions, NGOs, governments, community-based, community-led organizations. This is a critical priority for PEPFAR. It's been the case for the last few years and will continue to be the case going forward. We know this is a continued priority in COP21 and into the future. Next slide. When we talk about those partners, we really want to think about the holistic ecosystem of our partner base. And that means thinking about the individuals we serve and the community health workers, also looking at those organizations at a local level, faith-based organizations, community-based organizations, hospitals, private sector institutions, local government actors, national government actors, even regional partners who are now newly part of our local partner definition. And of course, international implementing partners, international donors, other actors, global private sector players are critical in the success of our HIV program. And as we make this transition to 70% funding, we know the roles will shift a little bit in this system, in this ecosystem, but that all of these actors are still critical for our success and the ultimate sustainability of our HIV program. Next slide. So USAID has various approaches for transitioning the funding to local partners through our grants and contracts that we issue. You can see some models here that have highlighted how we focused on restricting local competition, where there's a good base of local partners to implement our programs. In some cases where there's a unique aspect of a local partner that we've been able to do a sole source award to that organization. We've expanded and increased funding to our existing local partners who have had strong performance and could take on more. We've also seen a great increase in our government to government or direct government agreements. We term G2G agreements, where we've worked at national level and local level with government partners to implement our PEPFAR portfolio. We've also worked through transition awards where our international partners have a focus and a mandate to strengthen sub-partners to take on over a designated period of months or years to become prime USAID partners. And throughout all these approaches, we have ensured that there's dedicated capacity support. This is central to supporting our local partner transition. We have mechanisms at a global level, but also regional and bilateral level to support the capacity of our local partners to succeed. Next slide. So with any transition, there's risks involved, and we've ensured that we are thinking about risks from the very beginning. We've used our agency enterprise risk management approach and a risk profile to think through what are the risks and how do we manage or mitigate those risks going forward. Some of the key areas that we've looked at are noted here, these 5 boxes. We want to make sure we're really understanding the local context and have flexibility in our approaches based on the specific needs in a country. We want to ensure that we strengthen, if needed, local partner capacity, that we're working on our internal and external communication. This meeting is an example of one aspect of that. We want to ensure that we have effective partner oversight. And lastly, we want to make sure our USAID bureaucratic processes and any internal barriers are overcome so that working with USAID is not a barrier to the work we're trying to get through. Next slide. So today I'm going to focus on how we are monitoring the success of our local partners and this transition and ensuring this is looked at very closely for COP20. We're going to go through each of these 5 areas with some data and approaches to address each of these. And if you know anything about PEPFAR, you know that we love data. So we're going to have a little more data to get through and help thinking about how we look at local partner performance and success. So I'm going to go through to the next slide. First, to highlight our local partner funding. Next slide. So Clint noted across USAID portfolio, the goals that we've hit and the targets we've hit for our local partner funding. And in COP20, getting to 53% of our funding going to local organizations projected for this fiscal year coming up. But you can see that in each country, it's a very different path, and that when we began this initiative 2 years ago, we did not mandate each country to have a specific goal, but worked with our field teams to understand what was possible, what was feasible in the country context, and what was ambitious to try to increase our numbers. So all of these numbers change as we have gone through the last few years based on things that have happened in country, based on COVID, based on other occurrences, but we are very closely tracking each country's progress and expect that not every country will hit 70%, but that every country is seeing an increase in their funding going to local partners and building that capacity so that that is possible. Some countries may take a longer path to that and some may move more rapidly. So I wanted to highlight a few countries that have really had incredible growth over the last few years and have projections to get even higher. In particular, Kenya and Rwanda, we want to say congratulations for really having this big upward line of funding to local partners over the last few years and getting close to even 100% projections into the next fiscal year. We also want to note some countries that started out almost at 0% funding in our COP18 or fiscal year 19, and now are close to 50% or above in COP20 and getting beyond that in subsequent years as well. So again, every country is making progress, and we really want to thank all of our USAID missions and the incredible work it takes to shift this funding to local partners. Before I move to the next section, I also just wanted to note that it's not just the funding, as Clint mentioned, we have now a more diverse local partner funding base, and we've been able to add 72 new local partners to our USAID PEPFAR family. So we're really thrilled to have increased funding and increased partners to deliver on our programs. So next I'm going to dive into technical performance. Clint already highlighted this to some degree, but just to note, when we look at performance from past years, and this is fiscal year 19 or our COP18 cycle, and this is the last full year of data that we have on these prevention indicators, we can see in the prevention portfolio that local partners, depicted in red here, performed on par or in some cases slightly below or slightly above the international partner performance, and that's in blue. Still, local partners for the most part here had fewer targets in this portfolio, but we know going forward this year and next year that the local partner share of targets is also increasing here. Next slide. When we look at our testing and treatment data, this again is from fiscal year 19, our last full year of data. We see that there's some underperformance compared to international partners on testing PAUSE, which is identification of positive patients, and testing new people that we've initiated on treatment. Testing CUR, or those that we're supporting currently on treatment, is actually we have local partners with higher performance and a higher share of the targets, which is great to see. But we know when we dug into this data, and as Clint had noted, it really is important to look country by country and understand which partners, even which facilities are driving these numbers so that we can work closely with the technical teams in the mission at USAID, with the agreement officer representatives for those partners to address the challenges, create solutions, and improve these numbers. When we look to the next slide, and this was highlighted already by Clint, we see this sort of continued trend, and this is data from this just prior fiscal year, the 3 quarters as of June 2020. And we can see that for the first time, local partners actually have an increased share of targets, again, local in the red color, and have more targets than our international partner, but have struggled with identification of positive patients and new on treatment. So we want to understand how COVID is impacting our local partner performance. And again, as we do that, we look to particular countries and particular partners that are driving this. It is really a handful of countries. When you take out some of those countries, you see the performance become more on par again between local and international. We also, again, wanted to note that there's been great linkage for our local partner performance, which is a key indicator that we're also tracking outside of those traditional PEPFAR MER indicators. So in the next section, I wanted to highlight quality. So that's quality of services and quality data, which is so important. We don't want to shift our portfolio and then suffer in terms of quality. So next slide. We've been thinking about tracking quality, on the next slide, across 3 areas. So for our local partners, we're looking at our site quality measured by our Site Improvement Monitoring System, or SIMS. We've also been thinking about data quality measured through DQAs. And then a new area for PEPFAR is really looking at the community experience and perception of services. I'll talk a little bit more about this in a minute, but this is driven through our community-led monitoring program, which is new in COP20. Next slide. So SIMS, our site quality assessments, have been conducted for quite some time now. And so we wanted to look at the number of SIMS visits and how we're assessing local partners. We can see in fiscal year 19 that there were close to 1,000 SIMS visits conducted. In fiscal year 20, that number was reduced to just a little under 670 SIMS assessments. This is in large part due to COVID-19, which caused a reduction or really a pause on SIMS visits in Q3 and Q4. But what's great to see is that of the SIMS visits that were done in 2000 and FY20, there were 206 SIMS visits done with local partners compared to just 117 done in fiscal year 19. So as a portfolio is shifting to local partners, we see more and more SIMS visits conducted of those local partners. Namibia, Zimbabwe, Ukraine, Ethiopia, and Malawi, Haiti, and South Africa completed over 50% of their assessments for local partners. Next slide. But more important than the number of assessments, we were really thrilled to see the results of those SIMS quality assessments. So we've looked at some of the key areas or elements for PEPFAR for implementation in SIMS. And we're excited to see the green, meaning meets standards, really is strong for our local and regional partner sites. And the sites are at the facility, community, and even above site level of programs. Across all of these elements, you see that local partner programs or sites have even more meet standard of quality compared to international partners. So a great indication that our local partners are delivering quality programs. Next slide. So as I noted, we also are really want to make sure that our data quality is strong and that data quality assurance and data quality improvement are a key part of our programs. This is a multi-layered approach starting at policy and guidance from Usaid policy and OGAC or PEPFAR policies that mandate regular data quality assurance in all of our programs. But it's not just a one-time or a periodic assessment that we want to happen. We really want to see this happening down to the facility level on a regular daily basis almost. This routine data quality assurance is critical to make sure that we can rely on the data that we're generating to inform our programs and make corrections in real time. We also want to emphasize that this is not just a local partner responsibility, but it's really a joint responsibility between USAID and our local partners to ensure that there's data quality in our programs. Next slide. Our office has been working with implementing partners and others to develop data quality assurance tools and approaches that can help partners do this easily and quickly in your everyday program. There's a new tool that's been developed that really focuses on our treatment partners to help validate numbers for number of people on treatment currently. There are links in the slides that you'll have access to if you're interested in seeing those tools. And there's a planned training for local partners on data quality assurance expectations, approaches, and tools this upcoming November. There are mechanisms, and we have staff in our office centrally in Washington that can support local partners in any kind of technical needs you have in data assurance or quality assurance and quality improvement, and provide training. I've listed some contact information on the slide if you're interested to get more ideas on how to integrate this into your programs. Next slide. So the new area in PEPFAR for COP20 is community-led monitoring. So CLM is a requirement this fiscal year in our guidance last year for all PEPFAR programs to develop and support community-led monitoring of our PEPFAR services. So this is a really exciting opportunity to understand from a community perspective how our programs are working and the quality of our services. A critical piece to understand with this is that it has to be independent entities, civil society groups, organizations, coalitions, networks that are leading this community-led monitoring, and that will inform how we will use this data in PEPFAR to make corrections to how we operate. It's intended to really help those users of our health services and marginalized groups who often struggle to access our programs. Next slide. The fourth area to look at is financial performance. Next slide. So another data stream we have is looking at our budget data and our budget execution data or expenditure reporting. And more PEPFAR is really focused on ensuring that the way we budget our money is in alignment with how we expend our funds. So as we look historically at our data over the last few fiscal years, we see that local partner budget was on par with spending compared to international partners at 96% compared to 98%. Again, this is critical for our local partners to align their budget with the spend since it impacts your future funding. Next slide. And as we've looked at the expenditure data, another rich stream of data for PEPFAR, we've been also able to unpack how partners spend their money and tend to program their funds across different budget areas. And what we wanted to highlight here in red is program management costs, or sometimes what might be referred to as overhead of programs. And what we've seen on the bottom part of this graph is that local partners have been spending less than international partners on program management costs, somewhere between 11 and 15% over prior fiscal years. This is expenditure data. On the top part of the graph, we see budgets or planned funding for this fiscal year that's just ended and the next one, 21, that we're going into now. And you can see that while the funding for program management, or the budget for program management, is a little closer between international and local partners, it's still, we see the continued trend of local partners spending less on program management. So we'll be continuing to look at this data as it comes in future years, but it's important for us to understand and make sure that we are funding sufficiently those overhead costs, but also understanding the efficiencies that are possible but through our local partner programs. Next slide. So the last area we wanted to focus on was capacity, and our capacity building and partnership branch has focused on capacity and thinking about it in terms of these three buckets: organizational capacity across these elements you see listed, data and reporting capacity, and we've touched a little bit on data quality already, technical capacity to deliver on our programs, and we've tracked that, as we've already talked about, through our PEPFAR indicators. And if we go to the next slide, we're going to talk a little bit more about the organizational capacity side of these buckets. For the first time, our office has been able to pull together data on organizational capacity assessments. Every new local partner, in order to become a prime partner, must have a non-US pre-award survey, or NUPIS, done before the award can happen and be signed. So we've been able to gather 146 capacity assessments, primarily NUPIS, but also a few organizational capacity assessments, OCAs, or other types of assessments that have been done from across 125 partners in 19 countries. And you can see across these domains of the NUPIS that on average, the partner capacity has been light green or adequate capacity, which is great to see, with a little bit of variance between these elements. If you go to the next slide, we've looked at this also by country. And again, you can see a lot of light green and again, some shifts between country. But what is really critical for this data is to look partner by partner to understand where there are strengths and weaknesses and what we may do to address those. So for partners with low scores in certain domains, USAID can use special award conditions to make a provisional award while we address those weaknesses. And these capacity scores help us identify areas where partners may need additional support or training or embedded technical assistance. Next slide. Again, we have mechanisms in place to support all three of these buckets of capacity. ASAP, who is hosting this meeting, is delivering support to organizations on the organizational capacity and data and reporting capacity. DataFi, another mechanism, is supporting data and reporting and other technical capacity. And then RISE, EPIC, and Achieve are part of our central mechanisms, really focusing on the technical capacity. Also in our missions, we have bilateral, we have regional mechanisms that are supporting capacity development. And if you're interested in more information on capacity development, you can visit this link in the bottom of the page to find out more. Next slide. So I'm going to wrap up. And in sum, I wanted to highlight that we have really had, across these 5 areas, a lot to monitor and a lot of success, and we continue to focus on this coming into the COP20 cycle this fiscal year to ensure our local partners are successful, supported, and can deliver on our programs. We've been thrilled to see this 20% jump in our funding to local partners between COP18 and COP20. That represents about $305 million that have shifted to local partners in just over 2 years. And again, we have 181 USAID local partners now delivering on our PEPFAR portfolio. We're thrilled that the quality of these programs has been really strong, and that we are going to continue to monitor the quality of services and data for success. In terms of financial data, the expenditure data that shows this program management costs less than international partners is something that we want to understand better to look at potential efficiencies in our programs. And we want to remind everyone to really track your expenditures so that they align with your budget and can ensure continued levels of funding into the future. In terms of organizational capacity, again, we're glad to see this light green or adequate capacity globally, but really understand that there needs to be an organization by organization review of the capacity needs that need to be focused on for success. And performance is that area that really drives our programs and our understanding of how we're working, and we really need to improve some of those key indicators for local partners in particular countries and work with our missions to get those partners' performance on par or above our international partners' performance as they take on more and more of the portfolio. We also really need to understand the impact of COVID on our local partner performance and address and work to address that going forward as well. Next slide. So where are we going? As we shift these funds to local partners, we see a decreasing reliance on international donors and international implementing partners, and we want to begin to scale up our national HIV response, relying on local actors who ultimately are connected to sustainable financing mechanisms as well. This transition is sort of getting us closer to that scaling up of the national HIV response. Is a step in that direction, and we continue to work with you all so that we can imagine a world where we don't need PEPFAR anymore, but really are relying on our local actors to manage the full national HIV response. So with that, I want to say thank you to all our USAID missions. A special thank you to our team in OHA, Courtney, Latham, Christy, Callie, Lindsay, Ben, Anna, Mike, Anna, for all the support in this presentation. And thank you to the MPI incubator team for some of the templates for these slides. And last, just again, a real thank you to, on the next slide, a thank you to our local partners and you all for joining us, for being part of our USAID PEPFAR family, and for being here today and the next few days to engage in our workshop. I will turn it over to Callie for the next plenary.
Thanks, Debbie. Great to hear all of those, all of that data and all the things local partners should be thinking about for COP20. So we are running a few minutes behind schedule. The separate Zoom call for CEOs with our OHA front office has already started. And we, in this session, are going to just jump into our next plenary with our Tanzania partners. And I see Jason has brought up the slides. So Jason, I'm going to turn it over to you to kick off this session.
Okay. Thank you, everyone. Hopefully everybody can hear me okay. I just want to ask, Ayana, are you able to speak?
Yes, can you hear me?
Yes, I can. Wonderful.
Can you see me? Because I don't see, and I have them on video, but I just don't see it.
I cannot see you, Ayana. I can see Jason though.
Okay. Okay. I'll see if I can figure this out. But can we get started even if I'm not on video, and then if we're able to fix it, or no?
Yes, I think that would be great. Let's go ahead and get started because
Sure.
I see we have the other Tanzania panelists here as well.
Wonderful. Okay. Thank you, everybody, for dealing with our technical check. So hello, everyone. My name is Jason Porter. I'm a local partner strategy advisor with the USAID Office of HIV/AIDS. And I'll be hosting our presentation today and driving us through our slides. But first, I just want to say thank you very much to our presenters who we'll hear from today, and for all of you for joining us. I think we have a great presentation today to discuss co-ownership and co-creation of HIV programs in Tanzania, and we're really looking forward to hearing from our panelists in the discussion that we'll have today. Before we get started, I just would like to note a few housekeeping points. We do intend to have time to answer attendee questions at the end of our presentation. So if you have any questions, please place them in the chat function, which can be accessed by clicking on the chat icon at the bottom of your Zoom window. We'll be compiling these throughout the presentation and then addressing as many as we can when we have time at the end. Okay, so to start us off, we already heard from her, but I'd like to introduce Ayana Ogilo, who will be our moderator and who is the Office Director for the Office of Acquisition and Assistance in USAID Tanzania. Ayana will be leading us through our discussion today. Ayana, welcome, and please take it away.
Okay, yes, hi, welcome everybody. Thank you so much, Jason, for introducing me, and now I will introduce the panelists that are joining me today. So we have Dr. Samuel Ogilo. He is the Chief Executive Officer of the Association of Private Health Facilities in Tanzania. This is an organization that is now implementing our VMMC activity. We have Mr. Deogracias Rutatwa. He's also the CEO of the National Council of People Living with HIV/AIDS, so we say NACOPA here. We have Dr. Nkondia Senkuro. She is the Chief Executive Officer of the Benjamin William Mkapa Foundation, and they are implementing our Human Resources for Health activity. For the USAID side, we have Dr. Nawai Fida. He's the Prevention and Health Promotion Unit Lead at USAID Tanzania and works with the VMMC program. He is, we also have Mr. Gray Saga, Project Management Specialist at USAID Tanzania and the AOR for the activity being managed by, implemented by NACOPA. And finally, but of course not least, we have Mr. Godfrey Nyombi, Senior Public Health Specialist at USAID Tanzania, and he is working closely with the Benjamin William Mkapa Foundation. So welcome to the panelists. Okay, so before we get into our panel discussion, I want to make sure everyone knows what co-creation has meant here in Tanzania. It is the process by which we solicit and incorporate substantive input from stakeholders as we design new activities and or move through our awardee selection process. We co-create 100% of our new activities awarded in Tanzania, some through a more intensive process than others. So why co-creation? We want strong health programs with firm commitment from all stakeholders based on a common understanding of shared outcomes from the outset. And so that's why we co-create here in USAID Tanzania. Let me now invite my USAID colleagues to give a brief overview of the co-creation methods they used. Mr. Saga, please tell us about the process that was followed for the meaningful involvement of people living with HIV, the MIPA.
Okay, thank you, and good morning, good afternoon. And I'll just brief you on the process that we used for the NACOFA activity. And this is the National Council for People Living with the HIV. So the objective of the activity was to make sure that we have a technical approach which reflects the higher impact and evidence-based practices for increasing pure-HIV case identification, as well as improving retention and adherence into care and treatment for epidemic control. So actually USAID issued the RFA to NACOFA, and then they had a time when they had to prepare their application, and they presented the summary of the application to USAID, implementer communities that were selected, as well as government of Tanzania stakeholders. And then the implementer, the applicant, actually received the feedback from stakeholders, as well as from USAID on the technical approach. And they went to finalize their proposal and submitted the full application after receiving all the feedback from the stakeholders. So that was the process that we used for the meaningful involvement of people living with HIV. Thank you.
Ayanna, we can see your video, but we can't see you.
I see that now, but and also I realized I was on mute. I apologize. Please, so I'm going to fix the video. I have IT helping me here, but first let me just ask Mr. Nyombi, please explain how the Afia Ndelevu Award was co-created.
Thanks, Ayanna. Just for a translation, Afya Ndelevu is sustainable health in Tanzania. And the co-creation process for us really started before even the NOFO was released. And whereabout we had held some conversation with the applicant. USAID had some discussion with an applicant. The applicant here was Benjamin Mkapa. It was a sole source. And the reason why we had only Benjamin Mkapa is the fact that there was any other partner in the country that has been working on the approach that we wanted in contracting health workers and transition them into government. But Benjamin Mkapa have been doing this for the past 10 years. So we had a discussion with them to outline the activity parameters. But second, we had a USAID applicant and facility partners who were managing the health workers, a meeting together to just put down and lay down the expectations and share some information that would help the creation of this project. And then finally, the timelines, and also looking into the requirement for the health workers in the facility in service delivery. And lastly, we shared the draft PD with the applicant for review, and we received their comments. And thereafter, when we released the NOFO, we continued to have some conversation and consultation and feedback in the process of the award. That's the process we use for Benjamin Mkapa, the Afya Ndelevu activity, which is managing our healthcare workers, about 1,000 healthcare workers at the moment for service delivery partners. Over to you, Ayanna. Thank you.
Thank you so much. So now, Dr. Fida, please share your co-creation experience for the Tohara Salama Award.
Thanks, Ayanna. The co-creation process for the Tohara Salama or Safe VMNC program for the USAID Tanzania was handled in such a way that before releasing the RFP, we shared the PWS for a feedback, and the offerers submitted draft concept papers to the office, and the tech reviewed it intensively and provided feedback without evaluating them. And then the concept was submitted, and the offerers make a presentation to the tech. And finally, the tech submitted discussion questions to the competitive range offerers, and also met to discuss proposed responses and revisions, and they get USAID's real-time feedback. And that is how we reached to the final selection of the local implementing partner for the VMMC program. Over to you, Ayana.
Okay, thank you so much to all three of you for explaining that. Now that we have a basic understanding of the processes employed, I'd like to turn to our panelists from the three organizations. So first, the first question is, what surprised you about the co-creation process? And I asked Dr. Ogilo, please, to lead us off with giving us your reflections on the process.
Thank you, Hayana. What surprised us about this was we didn't expect a proposal to be arranged in such a way that it was expressed in stages, and the stages that were very, very different. And we had, the process was new and unexpected to the organization. Unlike other traditional proposal processes, it provided a platform for AFTA to view, to be listened to, and for our ideas to be taken. And also the various steps that USAID involved us is before and after the technical proposal submission helped us to build confidence. And that was very, very unusual compared to the traditionally known methods of proposal preparation and writing. But also the opportunity to provide information on the activity performance and work statements and the feedback from USAID before the technical proposal development was very, very unusual to us. So it was a process that got us, made us to be more involved, and there was a two-way traffic, and stage by stage, we understood what was required by USAID, and then we also had this together with what we knew and our expertise put together, merged together, and we finally came up with a very, very good proposal that was technically very strong on our side, and also USAID also so it was strong enough to move forward. So it was a surprise, but it was also very, very helpful to us in the process. Thank you.
Thank you so much, Dr. Ogilo. So now I want to ask Dr. Sankoro, if you'd please share what surprised you about the co-creation process.
Thank you. For our side as Mkapa Foundation, it was not very much of a surprise, but more of a learning curve for us. And we must recognize, as a local entity that has been implementing USAID-funded initiatives since 2009 as a sub-recipient, the previous experience, we did not go through the co-creation processes. So when this process was introduced by the USAID team, it was very well received, and it really enabled us comfortably to engage and experience two processes so far we've had. One was for the Afya Endelevu project, and another one was for the tuberculosis local organization network. And the lessons learned that we realized were with the Afya Endelevu, it was a unique one because it was a sole source procurement. Thus, it had some limitation of how detailed could we go in the co-creation process to inform the design of the NOFO. But still, we had quite adequate consultative process between USAID and us, which enabled our views to be well captured by the USAID team for action. Whereas, as opposed to the TB loan grant, this was a grant which was split into three main components. It had community, facility, and HRN policy, whereby they were prior determined. These splits was determined by USAID before the co-creation process. And thus, in a way, it determined or shaped the co-creation direction. So the process was inclusive, we must appreciate that, and it allowed views that we gave to USAID. Nevertheless, we need to contemplate here and see if this split perhaps should have been determined after the co-creation process rather than prior co-creation process. Perhaps it would have had a better informed vision of the TB loan split among the three components. But otherwise, it was a very exciting moment for us and very unique for one of the donors we've been working with. I mean, this was very unique for USAID compared to others. Thank you.
Thank you so much. Thank you for that feedback. So now I will go on to the next question, which is, how do you think the co-creation process improved your program? And I'll actually ask Dr. Senkoro to please start us off with giving your perspective on that. How did the co-creation process improve your HIV program? Just the HIV program.
Okay, so as I said, our project of Afya and Health was introduced by Godfrey earlier. It's very much focused on human resource for health, which links quite well with the HIV/AIDS services and outcomes. So it's mostly an input towards improving the HIV/AIDS program. At this very early stage, because we just started this in February 2020, the initial improvements are more on the evidence-driven HRH allocation. How best do we reallocate the human resource for health, and standardizing the payment of these human resource for health for the same scope that they are given to improve the HIV/AIDS service delivery. This exercise really attributed mostly to financial savings. This is a little bit unique, as I said earlier. For example, we've realized after this rationalization, we are able to save almost $1.1 million in 12 months, which has attributed to the ability to finance additional 200 more mid-level healthcare workers, which in other words have improved the access and coverage for HIV and AIDS services. But more so, we have managed to match up the scope of job of health workers with the skill set that is required. And we observed in this analysis that almost 62% of the existing human resource for health were not matching with the job which they are undertaking at the time. So this calls for us to reallocate and reorganize again the health workforce so that we can get better quality of care. This rationalization exercise helps us to get better quality of care for HIV/AIDS, also cost effectiveness for the program, and giving more concrete evidence towards HIV programming improvement. And that's our task that we're going to take up for the second year of the project.
Thank you, Dr. Senkoro. I'm now asking if Mr. Mutatwa could please give us your take on how the co-creation process improved your HIV program, MIPA. And please, turn on your camera if that's easy for you to do. Dale, gracias. So while we're waiting on him to come back on, let me just go to Dr. Ogilo. Could you please give us your thoughts about how the co-creation process has improved your HIV program?
Thank you, Hayana. The co-creation actually helped us to reflect and design comprehensive interventions that address the concerns of the beneficiaries locally and nationally, and that would align to our ministries' directives and policies, and also looking carefully into our strategies that aligned to HIV prevention and the program that we had in particular, which was the BMC program. We also learned new and innovative approaches and strategies that were incorporated into the project technical approach. And all was set on a platform with other partners who shared the experiences with us, because at least we got some time to listen to others, what they're talking about and what they're thinking. And so it broadened our understanding of what we're about to engage into. But also it improved the ownership of the strategies and approaches and coordination of the program. But it gave us time also to know about the donors' expectations and clarifications. as we got more time with USAID discussing issues and the questions that were being posed to us and responding to them, and the meetings that we had, frequent meetings. So we better understood the plans and the directives and the direction of USAID and their views on towards the project. But also, it also helped us to sit back a bit and look at what works best for us locally. And being from a private sector, we also had time to look and reflect how it would work between how the project would link with the private sector perspectives, and how we could bring in our capacity as a private sector into the project. So it was an opportunity that was very, very helpful for us during that process, and we believe it will be helpful to us during implementation. Thank you.
Thank you so much. So now we're going to see if Deogracias from NACOFA is available. Could you unmute your mic? We just want to know what you, how you think the co-creation process improved your HIV program.
Yes, thank you, Ayana. I'm happy to share with you our experiences on how the co-creation improved our HIV program. First of all, we have to acknowledge the fact that because it was a very participatory process, learning from USAID and learning from our partners, we were able to address the needs and priorities of beneficiaries while at the same time aligning with USAID priorities. So our program took into consideration of what was in the COP plan as part of its priorities, but again, we were able to address the needs of our beneficiaries and people living with HIV to ensure that what we are doing is actually going to benefit all the PLHIV as we being the community partners. But again, as you know, this was technically a process that helped us to know the technical focus of which and how we could actually incorporate the USAID or the PEPFAR considerations, because all the program that we're implementing, that we're developing, had it follow technically what PEPFAR is actually guiding us to ensure that what we do is actually technically in line with what is agreeing together with the government priorities. And since we are going to also implement a program together in partnership with our implementing partners and strategies to ensure that there is synergies in what we plan. The other thing was the fact that this was an opportunity to develop partnership and synergies to manage the results and the resources. During the co-creation process, when we met with the stakeholders and partners together with USAID, from the discussion and the inputs, we were able to gather what was very important in us, that what we do, we make sure that we work together in line with other implementing partners, but this could also help manage our resources and plan better, instead of putting more resources in one area while other partners would also be doing the same thing. So we were able to align what others were doing, just understanding, for instance, from the geographical locations, from the interventions that we're designing, particularly, for instance, in the areas where, for instance, we are focusing on contributing towards the facility partners are doing, and we are actually contributing from the community, for instance, ensuring that when we are doing activities to help on HIV testing, we make sure that what we focus is actually on demand creation, which becomes to be very effective, instead of actually doing different types of activities. At the end of the day, we'll be using the resources unnecessarily. But it was very important to us that during this process, the partners whom we were working together were able also to identify who were able to work with us and that would have a very potential contribution in the work that we're doing, so that to ensure that what we do has impact. We acknowledge the fact that this was an opportunity for program integration and also learning and to getting more what could be very new to support the program quality as part of innovations, but also learning from others what are doing and networking. So in totality, this program, this process had a lot to do in improving our program, and actually at the end of the day, we had our program scope expanding from the previous program that we were doing, because this was a follow-on program. We had a program that ended in December. This was called Sauti Yetu, and now we have this new program is called Hebu Tuyajenge. So in the previous, we were implementing a program 46 districts, but now we're actually implementing in 65 district councils. So in a nutshell, very much appreciate this process, because as it was engaging, it helped us to be more focused. It helped us to become more innovative, to improve the quality of our program. Thank you.
Thank you. Thank you so much. So Dr. Senkoro, I want to ask you, similar to NACOFA, your organization actually had a co-creation process that involved not only USAID, but also other stakeholders at the same table at the same time at one point. So what did you think about the USAID and stakeholder engagement before submitting your final proposal? What did you think about that particular process?
I think first it was very helpful as it provided more clarity and having common understanding of the visions and expectations by us, but also by USAID and our partners, the other stakeholders. And we really appreciate that there was very good pre-engagement with the USAID team, which was quite informative. And that gave us more confidence as we moved through the process of the co-creation. But we were also able to demonstrate our understanding, and vision, and provide our opinion on what's the best approach that we should take to realize results, what are the anticipated risks, and what mitigations should we apply, and limitation. This, of course, is anticipating risks and mitigation is also very helpful for risk sharing, but also recognizing the limitations and opportunities that will arise as we implement this program. We further learned that from USAID team, especially on having more clarity on the vision and the expected results from the project, the team, I must recognize, was very engaging and uptaking our opinions, which we provided. They also demonstrated very good trust, technical trust on our organization, and sustained the direction of the vision of this initiative that we've been undertaking of Afya Endelevu. And here I'm making reference to the Afya Endelevu initiative. Thank you.
Thank you. I appreciate that. So let me turn back to my USAID colleagues again. How does co-creation improve engagement with local partners? Mr. Saga, do you mind giving us your opinion or your perspective first?
Yeah, so the co-creation process that we use, I think, helped USAID and to understand in terms of what is the readiness and the capacity of the implementers. How are they well prepared to start into consideration the current technical recommendations that are coming from either PEPFAR or USAID in the project or activity design. Thank you.
Thank you. So Dr. Fida, could you please give us your perspective? How does co-creation improve USAID's engagement with local partners?
Thanks, Diana. In my view, as it was a very interactive process, it has provided USAID a very closer understanding of the implementing partners' readiness and also their existing capacity earlier in the process. And this has allowed USAID or our office to organize a focused support earlier in time. This is my one observation. Thank you.
Thank you. And finally, Mr. Nyombi, please give us your perspective on the same question. How does this improve our engagement with local partners?
Thanks, Ayana. I think the best that I've learned from the process is to just be on the same table. For example, for the AFIA and the level, we had three partners all sitting together: the service delivery partner and the AFIA and the level, the Benjamin Kappa program, as well as USAID, to be on the same table. It really bring trust. It really speed up the conversation and the processes through which we do our procurement processes. And I think without that, we really have a lot of curve to learn, a lot of time spent to exchange the understanding and to build that trust between USAID and service delivery and partners that are working with us, particularly the local partners. So for me, I think the best I can say that this could be done. This was done better than perhaps the way we could go onto our classical way. Which